people are making it out to.
All right, that Fauci thing does stick out as a handle on it, though. But we'll see.
Sure did.
John Roberts, thank you so much.
You bet.
All right, let's get to read from Dr. John Baugh, the Chief Medical Officer of the Remote Health Solutions Emergency Room Physician, Dixie Regional Medical Center, St. George, Utah. Really knows his stuff. So, Doctor, on this issue of what we could have and should have been able to pay attention to, leaving the politics out of it, if distancing measures had been indeed in effect, I don't think Dr. Fauci was, giving anything that was stunning that others didn't know, maybe all the way up to the president, that maybe this could have been mitigated somewhat. It's easy to play a Monday morning quarterback here, but your thoughts on that?
Yeah, I think you're right. I think that it is easy to look back and say, could we have done better? I think that we always could have done better, but this is an unprecedented event. Nobody really in the world in our lifetime has done anything like this. Could we have done better? Yeah, we could have used better technology. We could have distanced a little bit earlier, but I don't think that knowing what we know now, we would have done anything different back then, right?
Right. So, Doctor, let me add that one of the ideas that has come up in this coordinated press conference with mainly Northeastern governors led by his son, Andrew Cuomo, that they would have a coordinated response. Is it a danger from you as a medical professional, knows this stuff inside and out, for the country not to move in one lockstep? Or is it better in some regions not as adversely impacted by the virus to maybe unwind from these quasi-lockdown provisions in a sort of a rollout? What do you think?
So I do think that the rollout is smart. I think that when we look at how do we get the economy back on track and how do we get people back out into the world, back into their normal lives, I think there's a few ways that we can do that, and they're all equally important. We need to be looking at the declining new cases. We need to look at the declining death rate, and those can be geographic as well. We need to be starting on these antibody tests so we can figure out who's infected, who's been infected, who's got some immunity. And then we need to continue to have those new rapid testings to see who is gaining the disease rapidly. But then also I think that we need to be using some technology to be able to send patients home. The new ones, as we're able to sort of isolate and self-quarantine new individuals, new cases, and we can send those patients home with a device like we do already to be able to monitor their vital signs and take care of those patients away from the public in isolation. We can do that more individually rather than collectively. And that's one of the ways that we can really move the economy forward. Instead of isolating and quarantining the whole economy, we can isolate and quarantine individuals.
All right, real quickly, I won't play the entire soundbite for you. In fact, I won't play it at all. But the Minneapolis Federal Reserve head, Neil Kashkari, had said we should be prepared for 18 months, so bumpy rides and flare-ups here. He was speaking just about for the economy, but some of the bumps on the virus itself. Do you agree to that?
Yeah, it's funny when we look back at what we first were thinking and we first were told about the virus. It was coming out, and we were getting told 18 months, and then we see this flattening has really helped. And so I think there are areas that we're going to have early rollout and early back out to public. But I think that there are going to be areas in this country that are going to see some reemergence within the next 18 months. We're going to have to be looking at this fall. What's going to happen this fall when cold and flu season comes back again? Are we going to be prepared for that? We're not going to have a vaccine yet, that's for sure. Not something that's widely spread across the country and available to individuals. But yeah, we're going to see hiccups. We're going to see bumps for 18 months for sure.
Doctor, thank you very much for all your hard work. Just getting to the bottom of all of this. I know you have very little time for things like, sleep. But thank you, sir, very, very much. By the way, the doctor touched on this, and we will as well. What are the issues that have to be addressed or show a trend that would get people to say, all right, we can slowly unwind this? We'll look at that a lot more. Also get the read on what stimulus is being provided now to add on to the stimulus we already have. Democratic Senator Ben Cardin isn't impressed with this latest effort. In fact, isn't impressed at all. Answer this.